The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. With me this morning is my co-host, Vin Martello, our Director of Community Health Relations. Good morning, Vin.
Good morning, Dr. Smith. How are you on this winter morning? Dr. Smith, today's topic is one of major importance to everyone, every family, every community, and that is cancer and the preventative measures that can be taken to help.
Certainly, we've all been affected by it one way or another.
Absolutely. There's not a single family out there who hasn't. And our guest today is one of our esteemed community partners, Amy Wen from American Cancer Society, the Eastern Division with offices in New Windsor, right down the road in New Windsor. Amy is Senior Manager for Health Systems. She works with primary care providers and federally qualified health centers to improve cancer screening rates and promote American Cancer Society health initiatives. And Amy just celebrated her 10th year working at American Cancer Society.
Yes.
So,
yes.
Amy, congratulations.
Thank you.
And welcome.
Thank you so much for having me on the show, Dr. Smith and Vin. I know it's been a great, important topic for pretty much everybody in the community. So once again, thank you for having me here today.
Oh, sure. We're happy to have you.
So, Amy, before we talk about cancer rates and preventative measures, let's start with an overview of American Cancer Society.
Sure.
How did it get started? Who funds it? And what is its mission?
Sure. So the American Cancer Society actually started back in 1913. So over 100 years. We just celebrated our 100th birthday about 4 years ago. So it's definitely a milestone for the organization. When it first started, we had about 10 doctors and 5 regular folks like you and me. They got together and decided that it was an important topic to address. So the first sort of headquarter, if you will, was actually in New York City. So very, very close to us. And the mission of the Cancer Society, throughout 104 years, it has always been to save lives, celebrate lives, and to lead the fight for a world without cancer. So there are many ways that we do that. First of all, we are actually the largest voluntary health organizations in the world, basically, in the country as well. So we have so many community-based volunteers, different organizations, and then just throughout the community that we have so much support from everybody, financially as well as doing health initiatives. So we have been very, very grateful for the support that the community has been giving us.
So, Amy, we hear so much about cancer in the news. We hear about friends and family members being diagnosed. So here we are at 2017, right? And the Cancer Society started in 1913. So that's, if my math is right, 104 years. Yeah. So where are we at with cancer? Are we winning the battle? Are we making progress?
So I'm here to share a very, very encouraging news, which is that the cancer death rates is definitely dropping. According to the very recently released 2017 cancer statistics that's published annually by the American Cancer Society, it has shown that the cancer death rate has dropped 25% since 1991. So this number translates to more than 2.1 million cancer deaths that we were able to avoid. So that's definitely a very, very encouraging news. But you and I and everybody knows that in the community, we hear our neighbors, our friends, our closed family members, we hear about the diagnosis of cancer on a very regular basis. So we know that, it's definitely not a reason to stop fighting. Now we know that nearly 1 in 4 deaths in the U.S. is due to cancer. And it is unfortunately poised to overtake heart disease as the leading cause of death among Americans in the next several years. So we know that we still have a lot of work to do in terms of avoiding cancer being the leading cause of death here in the U.S.
Well, certainly, I think part of the reason for the decline in the rates can be attributed to the awareness of the effect of tobacco, cigarette smoking.
Absolutely.
Which has been linked to multiple cancers, certainly is closely linked to coronary artery disease, those 2 top killers in the United States. So I think that, there are certainly multiple factors involved, but tobacco smoking is very much a prime suspect as a cause of cancer. So the more success we have in helping people quit, getting them to quit, preventing kids from starting will be very much, I think, key in helping us to keep those rates declining, cancer as well as coronary artery disease in this country.
It's
Absolutely.
a major focus of our efforts in the health department, and our county executive is very involved and is really providing some great leadership in that area. So, Amy, is cancer preventable? And what forms of cancer might be preventable? How do people go about doing that?
So it's a great question. And fortunately, with all the medical advances that we have these days and throughout, 104 years, we have been able to identify some very evidence-based interventions that can prevent cancer as well as early detection of cancer. So, for example, lung cancer that you mentioned earlier, we know tobacco smoking is the number one reason that causes lung cancer. So, along with a lot of county health departments like Ulster County Department of Health and the state and different organizations across the country, even globally, the American Cancer Society has been playing the role of really the number one advocate to make sure that people know the harm that smoking causes. And we are also carrying out a lot of research studies on lung cancer to make sure that one day we can really eradicate it. So that's one. And then in terms of breast cancer, that's something that we are very passionate about. So for breast cancer screening, we encourage women to start talking about breast cancer screening with their physicians, starting from the age of 40 to 44. So have that discussion with their physicians to see what their options are. So from that age, we recommend, you have that option to talk about it in terms of getting annual mammogram. But from the age of 45 to 55, we encourage you to have annual mammogram. So that's something very important. We just revised our breast cancer screening guidelines last year or 2 years before. It's definitely in the forefront of cancer prevention and early detection when we talk about breast cancer screening. Just to add, if you are a woman age 50 and above, we recommend that every other year you get continued mammogram. And then that can last as long as you are in good health and you have, life expectancy of 10 years or more. So that's in terms of the, early detection of breast cancer. with regard to colorectal cancer screening, it's very, very preventable. And then there are so many ways that these days we can detect colorectal cancer early. So, for example, through colonoscopies, which should be done, every 10 years if there's no negative results or positive results, or if you don't have any family history or medical conditions, then, you should definitely have colonoscopies every 10 years, starting the age of 50.
The cancer starts most often as a polyp in the colon. So when the physician, screens and does the scoping, if they find that polyp, they can remove the polyp. If it turns out to be a cancerous polyp, literally you've given that person basically a cancer cure at that point or close to
Absolutely.
it. So it's well worth doing, and it's a minor inconvenience relative to the benefits that you can achieve by having that screening and preventing that kind of conditions. So.
Right. And in addition to doing colonoscopies, some people may not like the idea of doing colonoscopy. There are other options. One of them is stool-based testing. So it's basically taking stool samples, which you can do at the comfort of your home, and it's not as invasive as one may think comparing to colonoscopies. So, there are definitely different options when it comes to, colorectal cancer screening. And as Dr. Smith mentioned earlier, it's very, very preventable. So there's really no reason for anybody here to die because of colorectal cancer.
Right. And how many times can we say, how often can we say that diseases are preventable, right? I mean, we have the vaccine-based ones, but especially something like cancer. However minorly inconvenient it might be to get a screening, it's nothing in comparison to having to deal with the ordeal of cancer and personal change.
Absolutely.
So Dr. Smith, you had gathered some research on colon cancer prior to the show. Would you like to share some of that with us?
Oh, absolutely. Well, the statistics show us that nearly 9,000 New Yorkers develop colorectal cancer every year, and more than 3,000, about 3,300, die every year as a result. So the New York State Department of Health is actively working to improve that statistic. They've named March as Colon Cancer Awareness Month this year, and they will be hosting a number of ads to promote screening. And of course, the best method of screening is the one that the patient actually undergoes. So having the discussion with your doctor is so important in finding out which type of exam he or she would suggest to you based on your family history and other conditions.
All right. Absolutely. And we'll discuss more of this great information right after this short break. You're listening to Healthy Ulster Radio.
The excitement continues to build. The mission of Health Alliance is now made even stronger by our new partnership with the Westchester Medical Center Health Network. By combining a legacy of community-based care with WMC Health, we are building a stronger, healthier, and more vibrant community. We'll be collaborating to provide preventive, primary, specialty, and advanced care right here where you live, where we all live. Health Alliance and WMC Health, advancing care here. Visit HAHV.org to learn more.
Welcome back. You are listening to Healthy Ulster Radio. Our guest today is Amy Wen from the American Cancer Society. Amy, could you tell us a little bit more about colorectal cancer? We know that it's the second leading cause of cancer deaths among people in New York. And certainly in Ulster County, we're very concerned that we have as many people opt to have colorectal screening as possible. Our number right now in Ulster County is about 65% or so of our residents opt to do the colon cancer screening as they would be advised to do. And hopefully we want to achieve 80% of our population to have them opt for cancer screening and colorectal cancer screening. Can you tell us a little bit more about that initiative?
Sure. So the initiative is called 80% by 2018. Basically, it's an initiative that the American Cancer Society has in collaboration with CDC and many different other organizations, including New York State Department of Health. And I'm very glad that Ulster County Department of Health is also promoting the initiative. So the goal is really to reach 80% of eligible individuals who should get screening. So that population obviously would be people who are age 50 and above. So we hope to achieve that by year 2018.
And Amy, can you tell us a little bit about cervical cancer? I know that there are there screenings for that or preventative measures, and tell us a little bit about that.
Sure, absolutely. So cervical cancer was once one of the most common cause of cancer deaths for American women. But during the past 30 years or so, the death rate has dropped by more than 50%, primarily due to increased use of Pap test. So today we have the power to really prevent most cervical cancers through, testing, and most importantly, hopefully one day to eradicate it through HPV vaccination. So in terms of cervical cancer, early detection, if you are women age 21, you should really start thinking about getting Pap test. So between the age of 21 through 29, we recommend Pap test every 3 years. At this moment, you do not have to have HPV testing. But if you're a woman age 30 through 65, we recommend that you do co-testing every 5 years. So co-testing basically is the combination of Pap test and HPV testing, or every 3 years just with the Pap test. So we do have very evidence-based intervention in terms of doing early detection of cervical cancer screening. But now we actually have the power and the tool to completely eliminate cervical cancer by vaccinate our kids between the age of 11, 12, 13 with HPV vaccination. So that's something very, very encouraging, because that's really, the only vaccine that we have right now in terms of cancer prevention. So that's a pretty powerful tool that's there. So we encourage, if you are a parent, please do talk to your pediatrician or your kid's pediatrician about HPV vaccination.
And what a wonderful tool, right? I mean, I have an 11-year-old daughter, and
yes.
It's again, how often do we get a chance to really prevent something, a serious disease? And we have the tool, something you really need to consult your doctor about.
Absolutely.
It's very, very important. Amy, we know that cancer patients have, a lot of challenges on their plates. What are some of the things that American Cancer Society does to help folks who have been diagnosed?
I'm so glad you asked this question, because on the way here today, the weather in the winter is not too great. So we know cancer patients, for them, especially those folks who live in the rural area, transportation may not be great in terms of public transportation. And sometimes in winter weather conditions, it may pose a challenge. They have so many doctor appointments that they have to go to, talking about radiation treatments. It's 5 days a week for sometimes 4, 5, 6 weeks. And then chemo, you get so tired from chemo. So the American Cancer Society actually has a program called Road to Recovery. So basically, we have volunteer drivers who drive cancer patients to and from, their home to the medical facility, so they can get their treatment and medical appointments on time. So that's definitely, a service that being utilized a lot. The other program that we have for women particularly is our wig program. Basically, we provide wig to female patients who have hair loss issues because of their chemo or just their cancer treatment. So we provide free wigs to them free of charge. So that's, sometimes I think some of our services are best kept secret. So thank you for giving me this opportunity to promote some of these programs. And the other program that we have ongoing in the county right now in collaboration with local medical center is called Look Good, Feel Better. Basically, it's a program where we bring in volunteer cosmetologists and they teach female cancer patients how to do some of the very basic things that make them look good and feel better during their treatment. Mm-hmm. So these are some of the programs that we have in pretty much every community across the country. But if you really don't feel well and you do want to talk to someone, or you just want to simply get a little bit information about your diagnosis, you can always call the American Cancer Society 24 hours a day, 7 days a week at our hotline, which is 1-800-227-2345. 1-800-227-2345, or just simply log on to our website, which is www.cancer.org.
That's really terrific. What great services. We're so fortunate.
Imagine, though, too, if individuals have any questions regarding insurance coverage,
absolutely,
how they can go about getting some of these screenings at the Cancer Society, we provide that information as well.
Yes. We actually have a health insurance assistant hotline that we provide to patients who have specific questions regarding insurance. But just general, cancer information, about diagnosis, about treatment. Just remember, we are always here, even on holidays or New Year. Mm-hmm. The hotline is 24 hours a day, 7 days a week.
As we were talking about prevention, something popped into my mind that we had left out of this mix, which is melanoma, and going to a dermatologist to get screened for skin cancer, and the importance of using sunscreens.
Absolutely.
Dr. Smith, would you like to elaborate on that, or Amy, can you?
Well, certainly getting screened, to having your moles checked by a professional, and things that you look for are any suspicious changes in a mole where they may have multiple colors or start bleeding or what have you. But the solar radiation is known to be linked to the development of skin cancers, and it's important to use common sense and protect your skin from harsh solar radiation. And
mm-hmm. And I know that exam I have it every year, and it takes all of 15 minutes, sure. Mm-hmm. And the dermatologists, and it's just a great thing to do.
Absolutely. And again, an ounce of prevention too is worth a pound of cure. Truer words were never spoken.
And really, adults and especially children, to use sunscreen it's very, very important, because skin damage can occur many years, if not decades after.
After severe burn, absolutely.
Yeah. So it's especially
also, not to be afraid to have that mole checked, because when the mole is removed early on, or that lesion is removed early on, you can prevent the spread of that cancer, and your survival is therefore much better.
Right. And I mean, really, the bottom line is to educate yourself about screening, and more importantly, to take action. Be proactive about consulting your doctor, your healthcare provider, about the appropriate screenings for you and your family, and get them. There's no excuse. Get out there and get those screenings. There are a lot of resources in the Hudson Valley, but Amy, if people really want to be part of the answer and make a difference and really get informed, where do they go?
Once again, as I said, the American Cancer Society is really the largest voluntary health organization. So we have so many volunteers around. So please get involved. If you are a cancer patient or you are just looking for cancer information, our toll-free number, 1-800-227-2345, or our website, www.cancer.org, are two ways to get in touch with us 24 hours a day, 7 days a week. Also, locally in almost every community, we have an event that's called Relay for Life that's across the country. And traditionally, people think it's a fundraising event, but it is way more than just fundraising at events. It's also the biggest, as we say, survivor celebration and remembering those who have passed away due to cancer. So it serves so many purposes. And this year, as every years in the past, in Kingston, our Relay for Life event is on May 20th, which is a Saturday at Dietz Stadium. So if you are here in the area, please come out and join us for the day. If you are a survivor, bring your family members. If you have a loved one who's just newly diagnosed, bring the person or come by yourself, get information, get educated. So once again, thank you so much for supporting us.
Well, Amy, thank you so much for all of the great work that you and your colleagues do in celebrating your 10th year with American Cancer Society.
Amy, thank you.
It's really terrific. And that's about all the time we have for now. Please tune in next week for more information that you can use to keep yourself, your family, and your community healthy and strong with Healthy Ulster Radio. Bye-bye.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.